VBAC is vaginal birth after caesarean section. If you have previously had a caesarean section, you will be seeing a consultant during your pregnancy. At around 36 weeks, following a discussion with your midwife and obstetrician, you will have to decide whether to book an elective repeat caesarean section or plan a VBAC. Our overall aim is to ensure a healthy mother gives birth to a healthy baby whilst having a safe and satisfying experience. You should receive an information leaflet about VBAC. The decision regarding VBAC will be influenced by a number of factors, taking into account how this pregnancy is progressing, your feelings, plans for future children, and the reason for your previous caesarean. Approximately 3 out of 4 women will have a successful vaginal birth if they have had one previous caesarean and their current pregnancy is uncomplicated. There are many benefits to having a VBAC, including quicker recovery, no driving restrictions, and shorter hospital stay. You avoid all the risks associated with an operation and increase the likelihood of having subsequent vaginal births. You may also find that breastfeeding is easier to establish with an ability to move more freely. There is also a much lower risk of breathing difficulties for your baby. There are some factors that make you less likely to achieve a vaginal birth. These include having a BMI of over 30 at your booking appointment, or being over the age of 40, the need to be induced, or having a baby that is predicted to be over 4 kilograms. There is also less chance of success if it is less than 12 months since your previous caesarean, or the previous caesarean was for an obstructed labour. Normally, a VBAC is not recommended if you've had 3 or more previous caesareans, if you've had a previous rupture, or if you previously had a classical scar, which is a vertical incision on your uterus. If you decide to have a VBAC, there are potential problems that may arise. 25% of women will need a caesarean, normally due to labour slowing or concern for the well-being of your baby. There is a small chance that the scar on your uterus may separate and/or tear. This is known as dehiscence or rupture. If you go into labour naturally, the chance of this happening is 1 in 200 women, 0.5%. If you are induced, the risk increases by 2 to 3 times. There are normally warning signs of these complications, and your baby will then be delivered by caesarean. Serious consequences for you and your baby are rare. Serious risks to your baby, such as stillbirth and low oxygen levels causing damage, are higher than for a planned caesarean, but the same as they were in your first labour. If you have a VBAC, there are some things that we recommend. Firstly, it would be recommended that you have your baby in hospital on the labour ward. We recommend that your baby is continuously monitored and you have an intravenous cannula when you are in established labour. Your progress in labour should be assessed regularly, and early consideration for caesarean if it is indicated. We also advise that pushing is limited to 1 hour in the second stage. Pain relief is managed in the same as in any other labour, and we would still encourage you to spend the early stages of labour at home. It is still advised that you stay mobile in labour and use breathing and relaxation methods discussed in the other videos. It is important to consider what will happen if you do not go into labour spontaneously. You may wish to opt for an induction of labour or a caesarean section. Some people will choose to plan a caesarean section. There are also risks associated with this. It may be a longer and more difficult operation due to previous scar tissue. This means that there is a risk of damage to your bladder and bowel. It also increases the risk of the placenta growing into the previous scar, making removal difficult in future pregnancies. This can lead to bleeding, which could require a hysterectomy, removal of the uterus. The recovery time will be longer, and it's recommended that you don't drive for 6 weeks. With an elective section, there is more chance of your baby having breathing problems and being admitted to the neonatal unit. 4 to 5 babies in every 100 have problems. This normally resolves over a short period of time, and there are no long-term problems. All serious risks increase with every caesarean section you have. If you choose to have an elective caesarean, this will normally be booked around 39 weeks. It is important to consider what you would want if you went into labour before your booked date, as this occurs with 1 woman in every 10. Every woman is very individual, and therefore you should always have a discussion with your midwife and consultant to decide what is best for you and your family.